This afternoon, I am absolutely privileged to be part of this collection of talks entitled Public Safety Nets to Curb the Impact of Crisis on Vulnerable Populations. But before I get ahead of myself, let me first introduce myself and my panelists. I'm Himla Sudyal. I am currently the Executive Officer at the Academy of Science of South Africa. And prior to that, I was a laboratory-based scientist who has spent over 3 decades working in the field of human genetics in the Division of Human Genetics at the National Health Laboratory Service and the University of the Witwatersrand up in Johannesburg. And because of that work, I kind of got excited in a whole lot of issues. My primary focus was trying to understand the history of the peoples of Africa using a genetic approach. And because my work centered and focused around people, I have done a lot of field research going into Southern Africa and other parts of Africa, engaging with people to ask them to volunteer in my studies. And through that, I kind of opened my eyes to the plight of people across the African continent. And I somewhat got more involved in social issues. So I used my hard science and my research work to bring it to the focus of intersecting with society and societal impact. And then being a member of the academy and soon invited to serve on the council and eventually evolve into the position I am in, you realize the value of using science, scientific thinking, evidence-based science in bringing together the kind of collective to address societal issues. So that's from my perspective. And this afternoon, my esteemed colleagues, Professor Francie Lund, who is a research associate at UKZN, who specializes in social policy, is going to be leading us in part of the discussion. Francie was the director of the Social Protective Program of WIEGO, which is the Women in Informal Employment Globalizing and Organizing. Her research has focused on the impact of South Africa's pensions and grants in addressing poverty and inequality. Francie has been involved in a range of policy interventions, including chairing the Lund Committee on Child and Family Support. Francie, I wish someday there's something named after me as well. So I'm really in awe that you have a committee named after you. So well done on that. And she has also led discussions around the introduction, which finally culminated to the introduction of the Child Support Grant. And then my other colleague on the panel is Karabo Ozah, who is the director of the Center of Child Law at the University of Pretoria. In 2019, she was appointed by the Minister of Justice and Correctional Service to serve on the advisory committee of the South African Law Reform Commission's project on care of and contact with children. So colleagues, we are in for a treat. And so before we get going, welcome Francie and Karabo. If you can unmute yourselves for now, and so that we can greet our participants.
Right.
Good. Well, so I must say, colleagues, when I was asked to chair this, my first thing was, well, what is a public safety net? And the vision that came to my mind about a safety net, let alone the topic of discussion, was, you know, when you watch trapeze artists and they're swinging in these high things, doing these acrobatic things, and usually you have the man who's the strong one who swings around, and then the lady poses first, and then she gets on, does a few acrobatic twirls, and he's supposed to catch her at the right timing of the swing. This is the vision I had in my mind, and I thought, what happened if there wasn't a safety net at the bottom, if there was an accident? So that's the image that I configured in my brain when I thought about safety net. However, the safety net in this context is very, very different. So before we start, perhaps I should ask Karabo, how do you interpret the public safety net?
Thank you, Himla, and good afternoon to everyone. Well, I think your analogy that you were just using now is not really that different, because the whole point of it is to make sure that the person who's vulnerable, who's been doing her movements, does not end up falling onto the floor and you know, meeting some serious injuries if the net is not there. So the understanding of social safety nets in the context of our society would be that these are measures that are put in place mainly by government to try and assist members of the society that are vulnerable. And the important part being that it's focused on trying to alleviate poverty, trying to ensure that we kind of level the footing for people who have the least. And it's also supposed to be an approach that it's not contributory, so you can benefit from the safety nets without having to contribute. So in South Africa, you already mentioned that Professor Francie Lund had chaired the committees, and she knows way more than me about the child support grants, the elderly grants, the grants we have for children or persons with disabilities. We have also the foster care grants. So those are some forms of safety nets that are there in our community. But also we must remember that it's not only the monetary ones. We also have programs that are in kind. One that has been recently very topical and being an issue that everybody is trying to work in and led to even litigation was the school nutrition program that we have for children who go to school. Over 9 million children who benefited from the school nutrition program, and the impact of that stopping due to the COVID restrictions. So when you look at the definition, it's broad enough to include this. And it's not only in South Africa that actually we have this approaches. Obviously, we have other countries who have similar programs, including the school nutrition program, because it acknowledges the lived realities of persons who are vulnerable and tries to ameliorate those vulnerabilities so that you can at least enhance the outcomes for, in this case, children who are, for instance, in school and don't have enough nutrition.
Yeah, no, that's great. So you know, you're bringing in the angle of the nutritional program in schools, etc. But we'll pick up on that a little bit later. Francie, my hero, the person of wisdom.
You're very good at intimidating people, Himla.
No, I've been reading up about some of the work that you have done. I mean, as I've said, to have something named after you, etc., is like really, really cool stuff. But jokes aside, Francie, I mean, these are serious issues that we are talking about, and you have, you know, kind of intersected on the policy interface in a very, very significant way. And so I just would like to hear your take on how you interpret the public safety net.
Himla, I can't do better than what Karabo did just now. I really agreed with how you framed it, Karabo. And quite a bit of my presentation is to do with the boundaries, the fuzzy edges. So perhaps we should just launch away.
Excellent. All right, so a lot of the framing of operations of our governance is enshrined in our constitution. So with respect to the rights of everyone that the constitution affords us, Karabo, what would you say one of the striking issues that the COVID pandemic has exposed us to with respect to the rights of individuals and the way in which these rights could or could not have been, you know, met given our challenges with the COVID pandemic?
So Himla, I think generally and also specifically in relation to children, one of the things that COVID showed us is the fact that there's been some improvement in trying to create safety nets, but that we haven't gone far enough. So what came out of the COVID pandemic and the response to it, we know places shutting down, people not going to work, people who are in the informal working sector not being able to generate income. Those things had a dire impact on families, dire impact on children. And when you look at it, it's because we haven't gone far enough in trying to eradicate poverty or to try to dent it or to try to even attain some kind of equality if we're ever going to reach there, because sometimes I think that we are always chasing a moving target. So what we saw is that the most vulnerable became even more vulnerable, right? Because they're the ones who quickly lost means, did not have reserves, did not have any ways of being able to now fend for themselves. Obviously, we know that there had been some government responses that maybe we can get into a bit later as well in relation to trying to introduce the temporary grants, also trying to increase the child support grants temporarily after there was quite a lot of lobbying from a lot of NGOs in the country. So we saw government trying to respond to that in that way. But I think that the damage was already done. People had already suffered, people are continuing to suffer. And even when you look at the contributions that government has tried to now make, or the increase of safety nets, if I can call it that, seeing that we're looking at that, is that it doesn't go far enough. It doesn't go far enough because the disparities have grown, you know, and when you say now you have a 350 Rand grant, that is a grant that's given to a certain group of people who are not working, we know the reality is that what can you do with that much? So it's not nothing, but it's not sufficient. So it has actually shown that there's quite a lot that needed to be done, and that that also that government can do quite a lot if they want to. And that's something that we need to come back to and maybe see how we capitalize on the fact that the response to COVID showed that there actually can be a way that government can leverage and do more in a short period of time than we had always thought, you know.
Thank you. Francie, you wanted to add something to that?
Yes, please. Just to say that also at a very practical level, just as one example, it was quite unreasonable to expect the Unemployment Insurance Fund officers to take on both a new grant and increases in existing grants involving millions of applicants. But the other thing was that the officers for applications for instance, new applicants for the disability grant, which stands at 1,860 Rand a month, no new applications were being taken and existing offices closed down. And if you got the relief of just the COVID grant at all for you couldn't get the COVID grant of 350 if you already had an existing grant of any sort whatsoever. And the disability grant and the old age pension at 1,860 Rand a month are, you know, a factor of 4 times, at least 5, higher than the COVID grant. So I think there wasn't a lot of thoughtful interaction between those. I'm not saying that unsympathetically. COVID came like a terrible punishment from wherever and hit everyone simultaneously. But there were, I think it's a sign of something very serious that I would just raise also later on, is of the lack of knowledge and visibility about the social security system as a whole that's held within cognate departments, very important departments, such as Department of Health, the Treasury itself, provincial departments of the Treasury. I think that there's still this sort of very negative connotation of it's giving money to the poor, although there's lots of empirical evidence now that has been used to change opinions and to see the very positive developmental impacts that those social grants have.
No, of course. And I mean, you actually raised a very important scenario, that this crisis hit us like nothing you could have ever imagined before. But what happens is, even before the pandemic, we needed to have had our ducks in a row for the relevant departments engaging in a kind of strategic way to ensure some sort of cohesion for the betterment of society. But having said that, I mean, we all know that the only form of income that we have is from the taxation. And there's a very small proportion of people who contribute to that pool. And out of that, you have to take care of many needy or vulnerable, given the high unemployment rate and so on and so on. So there's not much in the kitty to start dishing out. So which brings us to another kind of scenario is how, if you had an opportunity to fix the problem, what is it that you would want to address first most to address the plight of vulnerable? Karabo, I know this is not, I mean, this is a off the top, not in your specialty area, but obviously we conscientized by these scenarios all the time. And so there's one thing to evaluate and critique, but if you were given the responsibility to redress the issues around the vulnerable, what are some of the things you would do? And also perhaps do that in light of some of the issues that you've been involved with.
Okay, yes. I mean, I think the starting point is that, you know, our constitutional rights, or the way our constitution is framed, and we must always remember that we're talking about social security nets, social safety nets and all that, but the footing of what we're talking about is something that is in our constitution, right? Our constitution makes provision for access to social security, generally for adults. It makes provision specifically for children. We argue that for children, their rights are not subject to progressive realization. And we've argued, made those arguments successfully in the courts, meaning that when you're looking at, let's say for argument's sake right now, the vulnerability, when we went to court together with Equal Education, Section 27, who were the main applicants in the case about the school nutrition program, the point was made that when you have a disaster situation, an emergency situation, and you have to respond, your response must, first on the top of your head, must be the most vulnerable. So we can forgive Department of Education for struggling the first 2 months where we, you know, April and March, where we were all in a panic. And then as they start to plan now in relation to now, how do we respond? Your first thought must go to, now we had all these 9 million children that used to get food from us. What is happening to them, and how do we enhance their protection during this by finding a way to still give them food so that they can survive? And we know that these children come from the poorest of the poor families as well. So then that will be then, how do we work with Department of Social Development to make sure that they're also assisting the families? We know that attempts were made to do that, but attempts did not go far enough. I think there's been a lot of reports about how the food parcels and all those measures that were tried to be put in place were not properly coordinated, did not reach the people who it needed to reach and all that. So I think the biggest thing is prioritizing and actually looking at the most vulnerable people. I mean, Francie mentioned the disability grant and the fact that people were not able to apply. What does that mean for their real life, their day-to-day life? Those are people who have no income. Persons with disabilities or even children with disabilities are the ones the most difficult to actually to look after. Did anybody think about prioritizing them? And we know, like for the disability grant, you have to do medical tests and there has to be reports. Even now, post the hard lockdown, who's taking steps to prioritize and actually to make sure that there's a fast track process for considering those applications? I don't think anybody is doing that. And I think those are kind of the things that we people need to focus on, is being efficient and realizing that the obligation to the most vulnerable is something that they have to take serious, because every day that you're not doing what needs to be done to help that person, their lives is becoming more and more dire. And we need to remind people of that. And as Francie said, we're not doing these people a favor. In our country, the way we formed our society, we have a social contract. We said that we will look after everybody's rights. We will try and redress the injustices of the past. That comes with the obligations to make sure that we try and alleviate poverty. We try and have grants to support those who can't find jobs. We know unemployment rates have gone way up. So you have to see the whole context and not see it as you're doing somebody a favor. And I would actually want to pose the question right now to all the departments: what are they doing to actually fast track some of the applications and the response that is needed for the most vulnerable members of our society post-COVID?
Wow, wow, wow. I mean, that's really a loaded insight that you have provided. And you absolutely hit the nail on the head by saying that we take the challenge to the different departments because it's, I mean, you know, it's 26 years post democracy. We've all been thinking a long ways from various departmental structures of, you know, the social contract, the common good for one and all. That is what we think when we think about the ethics and so on. But Francie, just to pick up on again the disability and the plight of the disabled, and of course the elderly. Do you want to perhaps comment on how we see the elderly as being vulnerable in all of this?
Sure, I can do that, Himla, but I'd just like to comment on the same question that you put to Karabo, if possible,
Yeah.
before that, and to say I disagree with you, Himla, in general about there wasn't much in the kitty. I think what COVID has shown in country after country after country is that there is money in the kitty, and that the crisis actually enabled the space that was there to be seen. I'm not saying that for all countries, and especially not for countries that are a lot poorer than South Africa, but even in South Africa, where we have what our spending on pensions and grants, what is it, about 140 or 50 billion a year now? And yet that extra 250 billion was found, in fact. Whether it'll get to where it's meant to go is a whole different issue. I think also that we've got basically a good system in place in terms of a technology system and information system based on a huge database that gets out to both rural and urban areas on a regular basis. So we had a really good positive platform on which to place and augment what was already there. And I think that we were very like Brazil in that instance, who have got a fantastic social security system database going to. Here, our social security goes to what, 20% of households, I think, 18 million people. And I think what is hidden from all of this, with the goodwill there has been the extent of corruption that there is deep inside the government system of grants, in collaboration with the private sector companies such as cash pay master systems, who themselves then give that information to private insurance companies, who then extract a lot of money from those private pensions. That's something, if there is chance to talk more about that later. In answer to your question, you can't fix that right now, but you can certainly fix it in the next year or two. Just fix it, get it out of the way, because of the undermining of the legitimacy of the whole system. And that itself, my last sentence now, that itself is going to impact on how the idea of a basic income grant or a universal basic income will be perceived and will or will not be allowed to happen. Thank you.
Yeah, but could you just pick up on my other question about how this affects the elderly?
I've completely forgot to get there. I was beginning to get a bit self-conscious about the amount of space I was taking up. I'm sorry about that.
No.
I think that I don't know the answer to the immediate impact on the elderly. One can imagine, we know incontrovertibly how much that pension income gets pooled in the households of poorer people in which there are elderly people living who do get the pension. And it improves nutritional levels and reduces depression levels, for instance, more in women than in men, probably because women are doing more of the domestic tasks that are being needed to be done. Given the extent of the existing system I think the answer to your question, Himla, would need to look at would be different according to whether you're looking at households in which there are only pensioners who have learned to get by on that money, they've made their financial plans, and or how it impacts differently on households in which, for instance, young men who were making remittances from the factories, and young women doing the same, and doing other maybe paid care workers, domestic workers, how much their missing income impacted on those families. You'd have to look at those things together.
Right. So, Karabo, would in addition to the schools, feeding program, etc., that you've highlighted, which other areas would you suggest that there are gaps that exist in the kind of systems approach that we have been talking about?
Look, I think that we've been touching on the vulnerable group that is persons with disabilities, and specifically also in relation to children with disabilities. That is a big area where there were issues before COVID, and the issues continue. So insofar as access to grants itself, we've been approached a few times in relation to the application process, and the fact that insofar as the system is concerned, there are challenges where doctors will do the reports and submit the reports and give the reports to the families to submit, and the reports are not accepted because there is an indication that or there's a decision by the officials that the family or the caregiver does not qualify for the grant because the child is not permanently disabled. And there's a lot of issues there about that process of how do you determine, how do you assess the medical assessments and the forms. There's been quite a lot of issues around that. That's something that we had looked at, we have to continue to look at. So that was already a barrier. And from what Francie had said already, now there was an issue with the applications during the lockdown, meaning that more people then and with families that have children with disabilities were not able to apply. And now the question going forward is, what does that mean now for them? Linked with that, we also did a case in relation to the plan by DBE for going back to school, and particularly focusing on what provisions was being made to ameliorate situation for children with disabilities. So remember, the DBE had directives and SOPs that they were publishing in relation to how schools must phase in and which children will be assisted, how many masks and all those things. And during the discussions about that, one of the things that became clear was that there was no clear thought to the different needs of children with different disabilities. And actually we had to end up launching litigation, which fortunately settled with the department on the day, deciding that they will revise the directives. But the sad part is that we had been telling them all the time that your directives do not go far enough, and also that the schools where children with disabilities attend would need more support. We already talked about the vulnerability. So now those are the most vulnerable members of society, and they're going back to school. You need to ensure that they have all that's required to still enable them to get, quality education under the circumstances that those that prevail. But as I say, we had to actually end up litigating because I think the department was not really getting it. And for me, that sadly actually indicates the fact that there are things that they had not been taking seriously even pre-COVID. There is, we know in the country, a big challenge in relation to access to education for children with disabilities, and really the taking of the obligation and really trying to make sure that all the children with disabilities, their access and their opportunities are maximized. It's not like we're doing them a favor and not saying, well, if they can't, they can't. And I remember one of the things that actually came up as well was the support that needed to be given to families who were not coping with children with disabilities at home, children who needed to be kept busy, children who had autism, who were struggling, families were struggling. And I think during COVID, it highlighted, already we know there's been problems before in relation to children with autism, for instance, accessing schooling and actually accessing proper stimulation and services. It got exacerbated during COVID. And I would also again like to now think about, what are we doing to support those families again to recover from those situations and to now provide further support. And I think one of the things that yesterday when we had an informal chat, I remember that came up, Francie, was the issue of, beyond the monies and everything, what are we really doing to provide support in our community? Support, I think Francie yesterday mentioned support to the elderly people. Is somebody checking on them if they're fine in our communities? Equally here, there's an issue about really, if we have, for instance, the Children's Act that talks about prevention and early interventions, but we don't have enough social workers going and checking on families and saying, well, maybe I can assist you to apply for a grant, or maybe you can go here. You know, we're also missing the whole component. It's not just about the money. I think it's good that we give people money, and money goes a long way, and people can decide how to improve their lives with it. But I think one of the big components that we need to really start focusing or refocusing on in South Africa is that social support that needs to come in relation to how do we physically support people who have certain challenges, be them the elderly, be them persons with disabilities, and also the parents who have children who are vulnerable. How do we give them that support? Where can they go for support if they're struggling with things, you know, apart from just getting their grants?
No, you're absolutely right. And before I let Francie respond, I just wanted to add, you know, disabilities in many ways is the product of genetic problems. On average, 1 out of 11 live births in this country is the result of some inherited genetic complication. And with it comes what we call rare diseases. So there's some rare diseases. So if you take all the rare diseases and some of the genetic conditions and you lump it all together, it poses a huge, huge burden in terms of what follows with relation to their health needs, etc. So many of the disabilities you see, be it albinism with like eye problems or any of the ones that we talk about, some with paralysis, etc., put demands on our services. However, very little is done starting from the Department of Health and every other sector of governance to actually consider this. And you know, when I was in human genetics and we would look at the burden of disease on the societal impact, it is not just looking at the medical conditions. As you've mentioned, patients with disabilities need wheelchairs and other kind of support structures. So it intersects in a wide array of health care providers that we need to bring to the fore. And so in terms of the vulnerability, as we've been discussing now, there's like a cascade of events that lead up to where we see things. And unfortunately, the advocacy for the collective support of how we take care of this, other than the support structure from families that come under the umbrella of Rare Diseases South Africa, other than that, there's very, very little support for this. And so I just want to put a punt for, you know, inherited disorders and rare diseases as something that should also be within our collective psyche to bring to the fore so that we give more support to these individuals and families who need it. Francie, over to you. Karabo had mentioned a few things, and I'm sure you would like to pick up on some of those and also add in a little bit from your own perspective.
Thank you. We've mentioned thank you very much, Himla. We've mentioned people in the field of service, so with physical disability and mental impairment. I want to just, I'm just going to mention, people use the word social work, including myself. I'm a delinquent, long time ago social worker myself. That was my initial training. If we just think, if there are about 20,000 social workers in this country compared to well over 100,000 nurses, so there are not a lot of them, social workers and auxiliaries. Think of these institutions which have been affected in this COVID crisis, and where social workers who are poorly paid get squashed with their own budgets. It's not because there's a very high budget for social security, that's legislated. So it doesn't matter what social workers do, those grants would remain, or by political determination be eroded. But if you think of all the homes for elderly people, if you think of the sheltered workshops who employ at whatever level people with physical and mental impairments, if you think of the specialized facilities for substance abusers, which is a huge field of service in South Africa, it has to be because there's so much drinking and drugs. Thinking of family counselors who are dispensing and dealing with dysfunctional, multi-problem families, and also trying to get kids into safe foster care and through safe adoption processes. Thinking of victims of gender-based violence. Thinking of social workers who operate in schools. All of the schools were closed during lockdown. Schools fortunate enough to have a school social worker, very few will have more than one. Those social workers are very important in the early referral of kids who are being, in say, early teens are showing real problem signs. And social workers who oversee the process of prisoners being discharged. Those are very, very specific things that we need someone in society to care about. And it sounds like we're talking about people at the bottom end of their luck, or people who are like marginal in some way. Yes, they may be marginal and they may be excluded, but the grants, I'm following up on what Karabo was insisting on, that the grants themselves may make a very, very positive difference to the ability of people of households, elderly people, to make a contribution there. They make a huge difference to the self-esteem and sense of worthiness of people with disabilities. But that work is by and large invisible, and we sort of lump it as a social problem rather than an economic problem. And the lack of resources for those people will, without a doubt, incur significant costs, economic costs, for, quite apart from psychosocial costs, on people who are themselves affected. And I think that the bottom line for me is that at the moment within the social policy field, the pensions and grants are getting a lot of really good attention and really, really good, there's good empirical evidence about what they do. I think that it can lead to the erosion or undermining of, or continuing invisibility of, the other social services that those social grants interact with, and could be even more effective if they interacted more with them.
No, you're absolutely right. You know, sometimes when you think about this and you think, well, what is more important in life, oxygen, water, or food? Because, you know, life cannot happen without one of those basic components missing. And as I listen to both of you who already have this collective insights, you've kind of presented a scenario of, you know, the complexity of the system, that nothing stands alone. They're all interrelated in some form or the other. And like, you know, even if you had an open purse, how do you start? How do you start to get over the onion layering of the complexity and the problems that we currently face? And I think by the way in which you have raised the various scenarios, you've kind of brought this to the fore. And so we have a huge challenge ahead of us. And it's not as if we started from a scenario where everything was working hunky-dory and, you know, life was at the top of the hill. It's just hasn't been a good vibe from pre-COVID, and as you've identified with the pandemic coming, with everything that's gone on, it's just seeped us deeper and deeper. And it's almost as if we are in this quicksand. And no matter what you do to get out, all you're doing is you're just going deeper and deeper into that abyss of problem. But anyway, I'm sure I'm wary of the time, and I want to give our audience an opportunity to engage with our colleagues. You've heard what they've had to say. They've kind of presented various scenarios from their professional points of view, and over and above that, shared with us how some other very important bits of information. So colleagues online, now's your opportunity. If you want to come into this discussion, you can either pose a question on the chat, or if you put up your hand, I will recognize you and give you an opportunity to say something. So are there any takers who would like to go and pose questions to Karabo and Francie for now? I'll start with the show of hands, but in the meantime, you can go ahead and also add some comments to the chat box so I can pick up your questions if you are shy and don't want to raise your hand and bring it to my attention. Are there any questions, Locha, from the Facebook? I see a hand. Catherine, go ahead, please, with your question.
Hi, thanks very much. I'm a PhD in public health student at the University of the Western Cape. And I'm just thinking that a lot has been discussed, and sorry, I've got a background noise happening here. A lot of criticism is made towards government, which most of it is valid. But we also know that many of the people working in government, those that aren't part of the corrupt group of people, are overworked and under-supported. And, I was just thinking, like, how do we engage with them more? I've attended a few of these webinars, these lunchtime webinars. Can we engage with some people from government to speak about what some of their challenges have been, and how they went about making decisions, doing things with the limited resources that they had? And I totally agree with a lot of the kind of critique that's been discussed around government's response. But how could civil society, academia, NGOs support government better in a response? I was almost thinking there should be some kind of department for emergencies or something like that, not to create another government department, but have some kind of a coordinating body, that it's not just kind of split between Department of Social Development, Department of Health, the Treasury, as you mentioned. Yeah, so I don't know if my point is getting across, but how do we engage with government better? Because it kind of always seems to be an us versus them approach. Not always, but yeah, we acknowledge that they are constrained and they need assistance. And often people who work in government and are doing good work reach the point where they just are too tired, burnt out, had enough, and then they move off to academia or civil society. And I'm an example of one of those people. I worked for the Department of Health for a number of years and then needed to move on. But yeah, I don't know if you have any thoughts on that.
No, that's a very good and fresh approach to the discussion. Let's start with Francie. Francie, do you want to have a comment to Catherine's question or comments?
Yeah, sure. Catherine, hello. I came here without a critical intent. I think that the performance of the government right from the beginning has been absolutely astonishingly good. I was not so absolutely astonishingly good, and I also have worked within government and have found it very exciting and very frustrating. I think that the intention here for me was to look at what are the threats posed to the existing social security, the public social safety, the existing pensions and grants, which are posed by a COVID context which are imposed by a COVID context, which are actually threatening to overwhelm the system. It was a stupid idea at the beginning to think that the UIF could carry this. It was just unrealistic, and that we could have sorted that out easily. I don't mean found the solution easily, but the opportunities that COVID has opened up to show that to show what cash transfers do, for instance, I think is a really valuable opportunity. And are there possibilities of converting that from a temporary opportunity to a better and permanent existing dispensation, if you like? The corruption within the social security system, as you would know, and I would insist on it, you can't do it if you're an individual outside of the system. You have to have officials cooperating, and you have to, if you want to be good at it, you need collaboration between the private sector outside and the public sector inside. But yeah, just to say that is the intent of what to learn from this, that we can take forward. And I think some things we can learn from South Africa, but I think other countries are also really learning about for instance, the need for better databases at a very technical level, the need, and it's not a magic bullet at all, in the use of digital technology, for instance.
Okay, now thanks, Francie, for that comment. Karabo, you can think about that one, but also my second question that both panelists can think about is, are there any tools left in the policy toolbox that we haven't reached for as yet? This is a question that comes from Julian. Given what we know from things happening internationally, is there something that we've missed or that is still out there for us to explore? Karabo, do you want to go first?
Yes, I'll go first. Can I just quickly answer the question about critique? I'll be very quick. I know we are mindful of time. So let me put it this way. I think we can engage with government so long as they want to engage with us, right? We can only assist as far as they give civil society an opportunity. In the work that we do, we litigate a lot against social development, against education, but actually we engage a lot. By the time we get to litigation, all else has failed. And we have a lot of friends in those departments that we know if we reach out to them, we can actually find solutions. We have a few cases right now where Department of Social Development was due to do certain things, and we've agreed to give them extension of times because we know the COVID has impacted on how things are done. But I think we must always remember, even when you're engaging with government and trying to not be too critical, you must always keep your eye on you trying to better the lives of somebody who's vulnerable. We won't back down with the critique if there are children losing out on things. That's something that I don't, in my work that we do, we don't compromise on. We'll talk at night, but if all else fails, we'll have to take the steps and warn you that we'll take the steps, because we can't let the vulnerable people continue to suffer. And I think that's something that we have to keep doing, because otherwise we're selling people the rights in the constitution that mean nothing. I think government itself needs to do a lot in terms of strengthening the support that they give to their workers inside and all those things. I think even private sector, a lot of companies have that problem. We know in the past few years, there's been a lot about wellness inside the workplaces and all those things. They need to do that, and they need to actually take the employees also very seriously to make sure that there's resilience, because when we come, we have also an obligation towards the vulnerable that we're trying to actually make sure that you as government, who has the main obligation, comply with. So that's my quick response. I don't know in terms of the tools and policies. I mean, my starting point is that in South Africa, we're actually good with policy and legislation. Most of the time we don't lack, we are not that great most of the time with implementation. So I think what we've been talking about is, again, reflecting on implementation. We have well-meaning, very good policies. We always try to make sure we're in line with international law as well. So what we need to actually now be going back to is our implementation. And as you said, how do we implement in a way that's not siloed? How we implement in a way that's integrated so that we achieve what we're trying to achieve in a better way? So that will be my quick response to that.
Thank you very much. Francie, what
toolbox?
The toolbox.
Thanks for the question, Julian. I'll choose one. And I think that would be, because it makes such a difference to knowledge and to advocacy, and that is costing studies of what it costs to mostly women to have to do the unpaid care work when the health and welfare facilities and budgets and that don't cover that spending. It's absolutely powerful when, and you can do them simply. I've done it on the case of a person in a very moderate black school who had to leave matric early because her mom died. And her lifelong costs, or her costs up to about the age of 40, of what income she couldn't earn because she had to leave school early. I think that all the way up, Julian, you'll remember Nina Hunter's PhD study, which both of us were involved in, where she costed out using different formulae the costs of care in the context of HIV and AIDS, using actual costs of actually being hospitalized or actually going to the hospice or going to the voluntary welfare organization or being cared for at home. Very comprehensive, very thorough. And so that would be a much more, that's really, really PhD level work over 3 years. But I think that we can base arguments about the need for social security and the need for better resources on a human rights base. But I think basing them in hard economics and costings is, so long as you've got your a logical and good value base to base those on, those costing things can do more to actually make, and now I'm caricaturing something called people and treasury, or economists as a whole, to actually understand that this isn't just naturally something called women's work or unpaid care work and it's marginal. It's fundamental to the good operation and indeed via path to economic growth as well. Thank you.
I'm sure that's a whole lecture on its own, just unpacking what you said, Francie. There's another question from Ursula Ahrens, and it goes as such. In addition to the vulnerable groups already identified, could you please advise on the status of migrants, refugees, and asylum seekers in South Africa and their access to social services during this period? I will ask Karabo to take this one, please.
Yeah, so just quickly, I mean, we know there were challenges. So irregular migrants, that's people who don't have a status in South Africa, who we can say, most of the time we say they're not legal in the country, had the challenge that they could not get out of the country, right? The borders are closed, they can't go back to Zim, to Malawi, and they can't eat, they can't work, they can't do all the work that they've been doing. And we do remember that when the food parcels were announced, there was an issue about the criteria of who gets the food parcels and who can get that. And I think Scalabrini in Cape Town took a matter to court where they won the right for everybody to be able to access food parcels. But there was, and I think I would say it continues to be a big problem, because the other difficulties that, particularly with irregular migrants, asylum seekers and refugees who are registered, remember, do exist on a system and are entitled to certain social assistance. But the irregular migrants or people who come on the 30-day kind of what do we call it, the visa, or the neighboring countries, and do work and go out and come back, I think if one was to do work, a short study on that now, you'll see that the circumstances are very dire, because they couldn't go out, they couldn't work, and most of them live in our informal settlements as well. So I do think that that's an area where people became more vulnerable. Let me put it that way. Yeah.
Thank you. Francie, I'm going to ask you to field the next question, and this comes from Stephen Devereux. Has COVID-19 created new vulnerabilities and new needs for safety nets, or has it exacerbated existing crises of poverty, unemployment, and inequality? Either way, how should social safety nets respond?
Thanks, but no thanks, Stephen. That's hard. That's really hard. It's too early to tell. And I'm not copping out, but in terms of the new vulnerabilities created, I think it's generated new conversations, completely new conversations about homeschooling. And I think it's brought to the surface the extraordinarily incompatibility and inequality between schools which are well-resourced and with good teachers and schools which are not in a position to offering very much, and where more and more responsibility were placed on parents at home, and particularly on women. I would like to think about that further, and I think it's yeah, thank you.
Complex, yeah.
I'd like to know if you can answer it. What does Stephen think?
Himla, can I maybe add one thing with your permission?
Sure.
I think for me, the big thing, and it's great that Francie mentioned the schools. So one of the things that, for instance, Equal Education, I think they had at a webinar earlier today, was already highlighting the fact that those schools that were the most vulnerable, the ones that children could not go back quickly because there's no water, there's pit latrines and all those things. Now government is cutting spending. So we've talked about how now there's been this money that we found, right, to respond to COVID.
Yes.
But going forward, budgets are shrinking for some of these things. So those grants that were going to infrastructure, that were going to eradicate the pit latrines, that we're going to put water, are actually going to now reduce, meaning that instead of taking the next 5 years to eradicate, you now take another 15 years. And that has direct consequences for the children who are there. It actually now means you have children who are being born today who have to go through pit latrines instead of, now you have another generation of children who will still bear the brunt of the existing inequality. And that's the thing, there were the existing inequalities before COVID that I do think that have now been exacerbated, because now, particularly in relation to funding, and I like Francie's idea of economics, it's very important. We can talk human rights and everything, but we need to bring it back to also the money, the reality of how economically that works. So I think that there's going to be a big problem in relation to all the departments across cutting funding, and how does that impact on people?
No, thank you. Thank you for those. Those are very nice closing statements from you. Francie, would you like to have a 1 minute closing statement to this conversation?
I am a bit of a worrier, and we haven't spoken much at all, which is fine, about the basic income grant. I worry very much about the possibility of a basic income grant being politically manipulated to lower, because it'll never come in at the high rates of the disability or old age grant. It just won't. It won't. And that it will erode, that the specific needs of some marginal groups will become less visible if we go for universality. And through my mother, I was born genetically with universality in my system, equality for all. But this one actually makes me even more of a worrier. And I would like to thank very much the Centre of Excellence, Julian and Himla, and Karabo. It's been a pleasure working alongside you. Thank you very much for this opportunity.
Wonderful, wonderful. So colleagues, I'm mindful that we've come to that hour where we have to close. And I have to thank my panelists, Karabo and Francie, for such a delightfully entertaining, thought-provoking and informative conversation. I kind of joked that if I was in a coffee shop and I met you for the first time and we had this conversation, you have shared your collective insights. You are like the living model of how you utilize the tools within your respective disciplines to come together and respond in such an effective way to the issues of societal relevance to one and all. Your passion has come through in these conversations, And I mean, I'm sure our audience has enjoyed this as immensely as I have. And I'm sorry that we've kind of run out of time for this. But hopefully, I will have my day when I could host both of you in a real lunch, not just a virtual one, because I believe that these conversations would go on forever. And just in closing, I want to once again thank the colleagues from UWC for giving us this opportunity of engagement. And please, colleagues, this is not the stop codon for this discussion. I am sure both Karabo and Francie would be willing to continue this engagement online, and we can do this through the center via Molachadi, our host. And so please do so, because you have touched the core of the essence of the way in which the social fiber of our societal values have come to the fore. Even though it's entrenched in the Constitution, I mean, Karabo hit the nail on the head when you said it's not our policies and our constitutions that's lacking. It's we need to reflect on the implementation. And so often we have seen that. And I also have some sympathy to departments. I mean, I know our own host, the Department of Science and Innovation, who has also taken a cut in budgets from Treasury, and this has hit all the government departments. And at a time where you need to raise the bar of bringing science and innovation and technology to the fore in an integrated way with social sciences and humanities at the core of it all, we are kind of playing robbing Peter to pay Paul in the hope that we will come out of this unscathed. Nevertheless, we can just hope for a brighter future and opportunities of where the lessons we have heard, we are being exposed to now will come to the fore with collegiality and human solidarity. As a collective, we can do better for the common good of one and all. So thanks so much, Karabo and Francie, once again. I absolutely love you people, and I look forward to an opportunity. Francie, I believe we're in the same neighborhood in KZN, so maybe I will hook up with you sometime. And Karabo, when I'm back in Pretoria, I will do the same with you. So thank you all. Thanks to all the participants for your engagement, and to those who have contributed to the discussion with your comments. Going forward, have an awesome day, and we look to see you soon. All the best, and thanks Loka for hosting us, and we look forward to future engagements with you. Bye now.
Thank you. Bye.
Bye. Thank you.
Bye.